everyone. I'm Ajad from the Village Family Services. Today we are chatting with Kelly Wallace. She is the owner and naturopathic doctor from Wallace Integrated Health Centre in North Bay, Ontario. Hey Kelly, how are you?
Hello there. I'm great. Thank you for having me.
Thank you for being here. Wallace Integrated Health Centre is a multidisciplinary natural health clinic with a naturopathic doctor, counseling and Reiki. Kelly, could you give us a brief description of what is included with the center?
Yes, absolutely. I will focus mostly on what I do as a naturopathic doctor because I understand you're going to be talking to V, who does the Reiki next week.
Yep.
And I'm sure if you wanted to talk to Brenda, who does the counseling at some point, she would probably be happy to do that too.
Perfect.
As a naturopathic doctor, I'm considered a primary healthcare provider, which means that you don't need a referral from anybody to see me. You can just decide that you need to see a naturopathic doctor, or you want to bring your children or a family member, and you can just call or email us and make an appointment. I have what I call a sort of a general practice or a family practice. So I do see all ages of folks from infants and babies through children and adults and seniors. And I deal with all sorts of concerns. And in naturopathic medicine, we use a lot of more natural therapies. We do a lot of work with nutrition. I do a lot of work with what I call sort of lifestyle counseling. So we look at how people's activities and physical activity and their food and their sleep patterns and their stresses and all of those things interact to affect their health. I am an expert in natural supplements. So if people have heard about a different vitamin, say on Dr. Oz or something like that, I can advise you if it really is a good idea for people or not, depending on your particular health.
So don't Google it. Call Kelly.
If you Google it, take it with a grain of salt, because sometimes Google has great information, but sometimes it doesn't.
Yeah.
And I do some acupuncture as well.
Oh, do you?
Yeah. So that's another tool in my toolbox. I have a special interest in women's health as well. So I do some work with bioidentical hormones and a lot of women's health concerns. So
could you explain to us what was that again?
Bioidentical hormones? Yeah. So as I said, my practice, I do see a lot of women, and a lot of women as they go through kind of midlife, 30s, 40s, 50s, and into perimenopause and menopause, hormones start changing. And the traditional route has either been, oh, it's just part of life, get used to it, or okay, we'll give you hormone replacement therapy, which has, some of the studies that have come out have shown that it does have some risks with it. Certainly increased cardiovascular risk and increased breast cancer risk and some of those things. So a lot of people are nervous about it. A lot of doctors are nervous about it, and they won't prescribe it anymore either. So women are really stuck often with not a lot of good options to deal with some of these symptoms. So bioidentical hormones are not the only thing I do. I do a lot of nutrition work, a lot of lifestyle work, a lot of work with a lot of herbs, a lot of different things that way that can be very helpful. But bioidentical hormones are one tool that they are still hormones. And we will add sometimes if somebody needs a little bit of estrogen or a little bit of progesterone or a little bit of thyroid. But bioidentical means that they are chemically, structurally exactly the same as the ones that our human body makes. Whereas the ones that were prescribed in the past, Premarin and some of those others, come from horses. Premarin comes from pregnant horses' urine, which sounds a bit disgusting.
Yeah.
And then a lot of the other ones are made in a lab, and they're slightly different from the ones that our bodies make. If you remember back to, way back to high school chemistry class when you used to build models of things with the little balls and the little sticks.
Yep.
So hormones, that's what they are. They're little things that look like that, and a lot of the ones out there on the market will have an extra stick or an extra ball added to make them just a little bit different so that the company can patent them and make them theirs. So they're not quite the same as what our body makes. They're close, but they're not exactly the same. And sometimes those little differences is what leads to a lot of this different side effects and things. So by using the ones that are identical to our body in very small doses as needed, sometimes that can be very helpful. So that's one other tool that I have in my toolbox as well.
That's really neat, really neat.
And
And
yeah,
there's so many women out there that are having issues, right? And
yes,
probably benefit from this.
yeah. So that's one area that I'm really passionate about, because I feel like it is an area that a lot of the conventional treatments have not been great over the years, and that there are a lot of women who are struggling there. So that's one area I'm really passionate about. I know this is a talk more about autism in particular, and it's not a huge focus of my practice, but I certainly do see some families and some children on the autistic spectrum. We look at a lot of nutrition and metabolic stuff in particular, usually with those cases. So a lot of these people have food sensitivities that they don't know about. And that can be really challenging to deal with somebody who's on the spectrum, because they often have very strong preferences about what they will and will not eat, and a lot of texture issues and things like that. But often if we can identify something there and make some changes, we can see some pretty dramatic effects. Also looking at sort of, are there key nutrients that they're deficient in? And there are, again, sometimes there's some genetic or some metabolic defects that will lead to deficiencies in things like zinc or magnesium or B12 or some of these key nutrients that, if they're low and we can get those levels back up to normal, can make a big difference. So those are a lot of the things that I'll look at initially, especially in kids on the autistic spectrum, and not just on the autistic spectrum. I also see a lot of kids, probably I see more kids with more of an ADD, ADHD diagnosis, which is not usually to the same level, but is, if we think of it as a really big spectrum, is further along in the, less severe spectrum. And a lot of those same principles apply. And that we're looking at the food, and we're looking at food sensitivities, we're looking at metabolism, we're looking at key nutrients, things like that. So that is something that, I do for sure. I feel like I'm just kind of rambling away here, but
no, it's very interesting. I'm sure a lot of people are going to relate to what you're saying.
I get excited about what I do.
That's good. It's your passion, right?
Yeah.
If someone wants to reach you, how do they go about it? Do you have a phone number, an email?
Yeah, both. Right now during COVID, the clinic is still open Monday to Friday, our regular hours. Most of the time I'm working here by myself right now. I do have an office assistant who's in a few hours here and there to help me out. So phone works if you're okay with leaving a message, because if I'm in an appointment with somebody, I might not get to the phone, but our phone number is 705-474-2727. And I always get back to people within one business day. Email also works well, and the email address is info@wallacehealth.com. And because of COVID, we're trying to do a lot of telemedicine. So I'm doing a lot of video consults with people. I'm doing a lot of phone consults if, the technology isn't there, or the internet connection isn't good at somebody's house. But I am able to still see people in person if medically that's necessary. So under the provincial framework, we are considered essential healthcare providers. And so we are able to have people in. We're just trying to minimize that as much as possible for everybody's safety.
Understandable. Well, thank you, Kelly, for being here today and for providing such great resources towards mental health and wellness.
Thank you very much. And my website is just wallacehealth.com as well, if anybody just wants to get a little bit more information about naturopathic medicine.
I'm sure they will.
Yeah.
So you enjoy the rest of your day.
Thank you. You too.